Thanks, Sue. So my name's Annette Lancy. I'm the Executive Director of System Policy and Reform within Family Safety Victoria. And one of the teams that work with me are doing a lot of the detailed work on the statewide service design for the hub. So I just wanted to take a few minutes to talk you through particularly the work that's been going on since the release of the statewide concept in early July on delivery model and the things that we are, thanks Karen, the things that we are proposing to prioritise in the initial phased approach to standing up the hubs. And then I'll hand over to my colleague Kelly, who will talk in a bit more detail about the local engagement and governance mechanisms that will support the hubs on the ground. And I would say there's the same slides almost identically in your pack, so no need to take detailed notes. So as I know many of you would know, both the Family Violence Royal Commission and the Roadmap for Reform looking at family services articulated the need for a different approach to supporting victim survivors, perpetrators and families and children to address some of the shortcomings within our current system. We know that while the system is staffed with practitioners and service providers who go over and above every day working to deliver the best for clients, to join them up to the services they need, we know that sometimes there are difficulties. That the service response can depend on which door you turn up at, what services you're aware of, and that people can get an inconsistent and a different response depending on where they are in the state. And we know that for clients themselves, this means that they experience a system in a way that they feel that they are they are kind of sent from place to place. They have to retell their story multiple times. It's overwhelming. They don't know who to seek advice. So I know I'm telling you things that for you in your services you see every single day. So obviously that was one of the impetuses for both the Family Violence Royal Commission and the Roadmap about how do we deliver a service for clients that stops that feeling of being overwhelmed and bumped around, that gives people support when they need it, so that they don't have to navigate the system, that we collectively have a system that works more effectively to support people and keep them safer. So obviously one element of that was a recommendation about the hubs as a new service model, not only a physical hub, but a new way of thinking about networking and delivering our services. The budget earlier in the year allocated over $440 million over the next few years. That will allow us to do a staged rollout of the hubs, starting with 5, starting this year to early next year, with a further 3 planned for 2019, and then we will move up by 2021 to have hubs coverage across all 17 DHHS areas across the state. Many of you would know the statewide concept that was released in early July, which articulated in some detail, but still at quite a high level, the model for the hubs, the concept. It articulated the kind of longer term vision and the aspiration that government has for how the hubs could operate over time. It's quite a long document, and it's ambitious and it's comprehensive. So one of the things that we've been doing since Family Safety Victoria was established in early July is doing a lot of thinking about how do we work together and start to realise that vision, but in a way that manages what is quite a significant change to our current service structure. So how do we do that in a way that builds and stages over time, but also in a way that is safe and provides better outcomes than we're able to provide today, that doesn't run the risk of going backwards or even more seriously, putting people in danger. As many of you know, the concept plan itself was informed by a significant period of consultation, co-design, a range of community conversations, consultation with various stakeholder forums, including expert design groups. So if that's where we are, I guess the next bit is to talk a little bit more about how we are thinking about how we then give life to that vision of the hubs in a manageable way in a relatively short time frame. So there are some things where the concept plan has given us some clear guidance that we're able to reconfirm today. So the hubs will be for both, excuse me, both for women, children, and various cohorts of people who are experiencing family violence, but also for families in need of support with the care and wellbeing and development of their children and young people. It will also, and as a part of our broader reforms to the system that look at holding perpetrators to account and in view, the hubs will have a role in planning for and ensuring that the system as a whole manages the risk that perpetrators pose, but also connects them with the relevant services that they can access to support behavioural change. We have decided and proposed that for male victims experiencing family violence, the police referrals, the L17s, will continue as they do now to be directed to the Victim Support Agency, who have particular skill and expertise in dealing with the particular range of supports and response that male victims may need in response to experiencing family violence. We're also really committed to the fact that the hubs, both the physical location and the service network that supports them, need to be inclusive places. That means not only being a welcoming front door for people who want to utilise the physical hub, but also that in all elements of our service design, we're thinking, as Sue mentioned, about designing for diversity and incorporating the particular needs of the various groups in the Victorian community. And we'll talk a little bit more through the presentation about the ways that we're starting to think about how we can support that, including advice from our diversity and intersectionality working group. So starting from one of the, I guess, the front door aspect of the hubs and the service network, we want to design the hubs in a way that it means they are safe, accessible for people to use. So as I said before, we want a service that people feel to come to, not a one that we force them to come to the door as it suits government or government's funding arrangements or current providers. That means we need a range of different access points. So the hubs will have telephone and online access, including supported by the existing local after-hours face-to-face responses where relevant. What we would anticipate is that while we have the 5 hubs, there wouldn't be a statewide number because of the complexity of having a statewide number when we don't have hubs in all places. But obviously over time, we'd be looking for a kind of recognisable number. But even so, we want a telephone number that's well known within the local area, so professionals know where to refer to, and over time people know where to call. We've talked a little bit, and I think most people know that the government intends to have a primary physical-based hub that is a welcoming and inclusive space that people can self-refer to, can make appointments to come to, or indeed can just come in. That obviously won't be the sole place though, because we're talking about geographic areas where could be a long distance to travel to the primary physical hub, and even for people who are geographically located nearby, we know that the experience within vulnerable families or with victim survivors is that one of the ways that their trauma and the coercive control that is placed on them manifests is in difficulties and restrictions placed on their movements or a growing feeling of social isolation. So for a range of reasons, not just the geographical proximity, we will have, as well as the hub, looking at over time having outposted hubs workers, the capacity for outreach, and particularly in areas where the area covers significant geographic distances, looking at spokes or other access points so people can get access to a similar level of service and support without being located in the kind of main town or the main area. As I've said before, as well as the ability to self-refer and come to the hub, it will continue to take, as we do now within our current service system, police referrals, L17s, for both victims, perpetrators and children. So the three places that L17s currently can go to will all come into the hub. But we'll also take the existing referrals from professionals and others. So whether that's existing referrals that may come from a maternal and child health nurse or a GP or a school teacher to the current Child First service, or indeed where you have other professionals within universal services or other services that want to refer someone for support and advice related to family violence. I just wanted to pause briefly and talk about our commitment to Aboriginal people. You'll see as we go through the slides a bit more, we talk a little bit about the role that we hope that Aboriginal community organisations can play in working with the hub. But it's worth calling out right at the front that one of the other guiding principles in the work we've been doing is honouring the commitment that the government has made and that FSB makes to honouring self-determination for Aboriginal people. What that means is we are very clear in our view that we want and need Aboriginal voices embedded in the hubs. We have some suggestions about how we might best operationalise that, but it's really important that we're clear that no decisions have been made about how Aboriginal community organisations will operate in the hub. There will be, and we'll talk as we go through the slides, about the various strands of engagement, a particular strand of engagement with Aboriginal community, both at the local and at their various statewide and partnership forums about how we best do that with them. But we're really clear that we need to honour the concept plan's view about the fact that for Aboriginal community there needs to be a choice for them about where they best want to access services. Is it through a hub, through what we call a kind of mainstream service, or is it through working directly with an Aboriginal controlled organisation? And so that, as I said, it's really just important to call that out as we go through the later slides, that this is an aspect that will continue to evolve in conversation with Aboriginal community. So I'll spend a bit of time on this slide. So, as I said, in the concept plan, we've had to work through the range of things that over time the hubs will build and be able to do. We obviously can't turn on safely and effectively all of those elements in a relatively short time frame. So the proposal is that we phase and stage the stand-up of the hubs with a particular focus in the next few months of what we think of as kind of the fundamental supports that a service model needs to be able to provide to victim survivors and to families who need support with the well-being of their children. So that means, as I've talked about a little bit more in the last slide, a visible but non-stigmatising contact point. And that's a real challenge about how do we use branding, advertising, the service networks, the referral pathways that exist and that are developed in a service network between different practitioners in different services. How do we do that in a way that encourages people to find their way to the hub and the service network, but also doesn't do that in a stigmatising way or in a way that could potentially compromise their safety? So a lot of thinking and work has been doing look at how do other services manage this, particularly services that currently deal with both victims and perpetrators, and how do we do that in a way that to reflect one stakeholder doesn't look like a police station, that is also welcoming and inclusive. The next component of the hub service model that we really need to do the next stage of work about how we do the detailed design is a multidisciplinary risk and needs identification process. So looking at hub-like models in other jurisdictions, this is a really important element, allows specialist expertise, so people who have expertise in dealing with children, people who have expertise in dealing with victim survivors, and people who have expertise in dealing with how you effectively engage with perpetrators, with male perpetrators of violence, bringing those together to have a richer and more informed conversation about, in a particular situation, what is the level of risk posed to a woman, to her children, if there are children involved, and then what is the bones of a safety plan? What is the activity that the service network can come together, and how can we most effectively support and work with the various members in that scenario? So there's obviously more work to be done in terms of exactly how that process would operate. There are various models of this that already operate in in pockets around the state, and we've been doing a lot of work learning from those, understanding those, talking to people who work in those about what they think works, what they would like to expand on. The next element, which is closely related, is then the hubs having the ability to then coordinate an engagement, initial service planning and allocation. So moving multidisciplinary risk assessment and needs assessment from not simply a meeting where we share information that various parties may have, but then taking that forward to a conversation about, well, what does this mean about how we then best work with this family, this woman, this man, and how do we coordinate that in a way that means people get access to the supports they need in a sequence and a way that makes most sense for them. We are also interested in looking at the ability of the hubs. So some of that allocation activity, some of that will of course mean that the hub won't then have many case managers on staff who then take those clients and work with them within the hub. Part of this will be about more effectively and more quickly working out how should clients be best allocated through to the broader service network that sits in a local area and can support a hub. So particularly where there's obvious from the specialist expertise around that table that this may be a woman or a family that will need fairly intensive support over a long period of time. Part of the next stage in the design process will be about, well, how do we quickly identify those clients and allocate them to a case manager or a support system that can work with them over a longer period of time. So get people more quickly for those people who need early intervention and have a high risk of escalating issues. That said, we are interested in exploring whether there is capacity within the hub model for some level of brief interventions to be delivered without having to on-refer or allocate clients to what we would colloquially call the back end of the service system. So that could be a range of things. It could be outreach, it could be brief therapeutic interventions, but it could be even a more coordinated approach to practical support and to practice the things that will help people immediately. They won't need to sit in a queue for a service elsewhere, but it supports them, and then they continue on, and they know then when and where to come back to if in the future they need further assistance and advice. But that's part of trying to shift the model through hubs of intervening earlier and trying not to have a system where people hold and wait for their situation to escalate to a point where they need a much more intensive and longer term intervention, which we know both from the Royal Commission but particularly from the Roadmap for Reform is a particular challenge within the family services sector. Finally, the foundational model will also be looking at how we have a better view of the service system as a whole. So how do we use the ability of trying to support people to come through the hub and the hub relating to the service network to have a better sense of service capacity within the area. So that's both, are there places out in the broader range of services that are available for people who need support? Help us gather information that might inform future investment about where there's need for additional support. Also help us understand at a kind of local system level, are there common blockages that we see to accessing particular types of services where we can come together locally to think about how we more effectively unblock elements of the service system. It also means we will have the capacity to track, I think, in a more effective way than we are in our current systems, where we fund through particular program lenses and we use different systems. We have a better sense of being able to track the client experience and the outcomes for clients. And we'll be able to use that over time to then inform the further iterations of both the hub model, but also within existing services themselves. And again, that will obviously build on a lot of the work that a number of services already do about tracking client experience and outcomes. So if that's, I suppose, what we want to deliver, just talk briefly about how we're proposing to deliver it in terms of particularly the workforce. So many of you will know the concept plan flagged that there could be a range of delivery models or workforce models for the hub. The government has decided to use what we would call a hybrid approach that tries to leverage the strengths of both government and non-government agencies into a model where we work effectively in partnership to give the best experience possible and the most effective support. So that will involve partnerships, how that will work. Agencies that currently are the L17 intake point for Specialist Women's, Specialist Men's and the Child First Service. We will be asking those agencies in each of the 5 launch areas to co-locate intake workers within the physical hub. And then that will mean, as co-located, then they're able to, as I talked about before, work together in that triage, assessment, collaborative service planning. As I've mentioned before, we want very much for Aboriginal voice to be embedded in that. We would like ACCOs and other service providers to also be present in the hubs, but we need to work through with them exactly whether that's what they want and that's what their community wants and whether that would be the best way to service them. The proposal is that those workers from agencies who come in to perform those client-facing hub functions, whether it's intake assessment, but also potentially the brief intervention work, that those workers would remain employed by their home agency. So they will retain that connection to the specialist service and the workforce that they currently work with. To support that, Family Safety Victoria will employ a small number of staff that will also work out of the hub. A centre manager, but then a small number of staff who can help with the facilitation, partnership and some of the administrative and other arrangements. As well as the workers coming together and bringing their existing expertise, we will be working and further refining a range of tools and supports and resources that will support the practice within the hub. So that's not only the integrated practice framework, but workers coming into the hubs will be some of the first workers across the state trained in some of the other reforms that government's working on. So the tools that will support a revised risk assessment and risk management framework, the tools that will support the family violence information sharing regime, and also access to the pilot version of the central information point, which will allow us to give in a consolidated fashion some information that is held by child protection, courts, Victoria Police and the corrections system about perpetrators or alleged perpetrators. And then the other thing that is important to note is that foundational service offer obviously doesn't cover the full range of services and supports that we know from talking to victim survivors as well as talking to current service systems, the range of things that people may need to do. So in all of the in the hubs, we also have, and it varies a little bit in terms of the capacity, but we are looking for some capacity for services to co-locate their service delivery functions within the hub if they so choose to do so. That could be either the specialist services that are coming together to provide intake, but also could be other services that we know are often sought by victims, and so such as legal assistance. In particular communities, it may be particular visits from immigration lawyers who can support with what are the implications for visas and residency, if that's one element of a person's situation. So we're open to talking with local communities about what would be the most suitable services that may want to co-locate, including with some kind of, as it happens now in a lot of places, kind of a worker coming for certain periods. Sorry, that is just a visual representation of what I just talked through. Probably the thing that's worth noting on this slide before we move on is there are obviously a number of new roles. So the centre manager role that we talked about, but also within the kind of service delivery stream, so not the FSB, the bits that we would be seeking CSOs to auspice. There's also some specialist roles around an integrated practice leader. There's the Advanced Family Violence Practitioner, which was recommended in the Family Violence Royal Commission. And again, just to call out that we would like to embed within the hubs from day one an Aboriginal specialist worker who can provide not only secondary consultation but but be there and be able to provide appropriate support and advice about how to deal effectively with Aboriginal clients. I won't spend long on this slide. It reflects, I think, the point that Sue already made in her opening about, obviously, it's, I think, really tempting with a hub to focus firstly on the physical location, but then also even when you get your head around it's the hubs as a service model, which includes not only the physical location but the network around it. But then it's tempting to think of the hubs as being the only thing. And obviously this is just to reinforce that there are a range of other really significant system reforms that will support and complement the work of the hubs. In addition, we are working very closely across government. I know many of you are involved in multiple processes around how we also ensure that the hubs model works effectively and connects to other significant reforms in other service sectors. So there's obviously the work in the Stronger Families, Safer Children work, which is looking at changes to the the Child and Family Services platform. There's also a lot of work away in the justice space, including the rollout of specialist family violence courts. So a key bit in this next stage will be, we have one hub area where there will also be a specialist family violence court. So we're particularly working on how the interface will happen in that area where there will be both, but more broadly, how as courts and police are amending their models and ways of working to be more responsive to the needs of victims, to have a better understanding of how those systems can be potentially used by perpetrators to further perpetuate trauma and control over victims. We'll be working really closely with them about how, as they move their practice, how does that integrate and work effectively with the new models of practice and service delivery that the hubs will help to operate. So that's obviously a good segue into, we're really conscious that there are a wide range of potential services where we need to have clear referral pathways for the days when the hubs open their doors. What we are proposing to do in this next stage is that at the local area there will obviously need to be referral pathways that cover the suite of services, but we're particularly focused on including at a statewide level where there is a kind of a statewide organising or head office in some cases. There'll be some particular agencies or entities with whom we will be prioritising settling a formal protocol before the end of the year. And that's what we kind of think of as, if you like, that I guess the first ring of services that we know from talking to practitioners and victims are the services that they are most likely need to access, but obviously they're not the only ones. And so over time and into next year, we will follow that up with similar interface protocols being agreed with other services. So that's the task. I'll just stop on obviously how, in a timing sense, that ends up looking. It's a lot of work, but I suppose we have a really strong commitment, and we're building on a lot of the really detailed work that has been done over the last 18 months. And really now we are leading up to a fairly intense period of work where we work through all the nuts and bolts that actually translate what I've talked about in a kind of conceptual service model to how we then actually provide the level of clarity and consistency that service providers need to actually make this happen. So over the next 4 to 6 weeks, during the remainder of October and November, there will be a really intense period of statewide service design that will get to confirming the service specifications, the variations that we need to make to existed funded agency contracts to support the movement of staff into the hubs and the coming together of the team. We'll at the same time be finalising the accountability and oversight mechanisms, infrastructure including a customer relationship management tool that will allow us to capture the details of clients and also what services are provided for them and where they are referred on. And again, to gather over time information about client outcomes and client experience. We'll be finalising an evaluation framework, and that will need to be a framework that obviously allows us to evaluate as we go. So not a kind of 5-year thing where we'll be able to tell you in 2021 or 2022 whether the model worked or not. It will be an evaluation framework that will ensure that we are receiving information and sharing information about the effectiveness of the hubs pretty much almost from day one, and then using that information to both further refine where we need to refine the model in the 5 hubs, but also to inform any refinements that we need to the hubs model for future rollout phases. We will also be, as I talked on the last slide, finalising those detailed service referral pathways and protocols. So that's clear both at a statewide and a local level. Alongside that statewide design work and getting to that level of detail that allows us to actually action this from a service system point of view, there will be at the same time a ramping up of the kind of local implementation and planning work that has to start now to ensure that we have people ready to undertake these activities and support clients. But I'm going to stop there because it's a good segue to Kelly.